Welcome back from lunch. We hope you had a nice lunch and a nice yoga. A number of people seem to be participating in yoga, so that was lovely to see. This session is a wonderful panel on planetary health and planetary boundaries, and it is moderated by Jane Madgwick, who serves as the Chief Executive Officer of Plantlife International and leads the organization to champion the conservation of wild plants and fungi and deliver nature and climate solutions worldwide. She is passionate and highly experienced as a conservation leader with a focus on collaboration and innovation to scale up impact, and has worked internationally the last 30 years, connecting local and global solutions. Most notably, Jane served as CEO of Wetlands International for 19 years after working for WWF in Europe and Australia. She became the first executive director of the Global Commons Alliance, furthering Earth system science as a basis for systems change before joining Plantlife in July of 2025. So welcome, Jane, and to the whole panel. Thank you.
Thank you, Rachel. Thank you very much. Hope you enjoyed your lunch and your yoga or your walk around and come back ready for this next session. It's fantastic to be here in this Planetary Health Conference. I'm back in the Netherlands. I moved house and home from the Netherlands after 21 years a week ago. I'm already back. Very nice it is too. So this session is sandwiched between the 10-year anniversary session, which was quite a reflection, and the session following us on the roadmap. So this is the session where we start to get down to the nitty-gritty. We start to look at what's it going to take? What signals, what wisdom can we bring forward into the roadmap? And we're going to have a conversation more than a presentation, a conversation about the connections between planetary boundaries and planetary health and how to make those connections work more smoothly so that we can disrupt the systems that are frustrating progress, so that we can move towards those positive tipping points that earlier speakers have mentioned. We've heard in the last session that this is a fast-growing movement for planetary health. I was a bit cynical about that, to be honest, a couple of years ago, but I went to the last FAM in Malaysia and I became a believer. It's really happening and it's very exciting. And we know a lot of things. We share a lot already as a community that destabilization of the Earth system is bad for our health, and vice versa, that if we can help to heal nature and the planet, it's going to be good for our health. We've heard there are lots of opportunities to shape the world to be a better place with the knowledge that we've had. We know also that it's complex and uncertain. And that we don't have a lot of things. We don't have the institutions, policies that we need, and we don't have a flow of investments going to the right people in the right places. So what lies in between? What do we need to overcome? That's what we're going to look into with the help of the panel. How do we make this transdisciplinary collaboration really work? And I'm not going to answer any of these questions. Luckily, we have a stellar panel who are going to help us with this. So let me start with Lisa on my left, to your right, Lisa Poertner. Welcome. Lisa is a medical doctor and she's a research associate at Charité, Institute for Public Health in Berlin. She's also a researcher at PIC, which, as you probably know, is the Potsdam Institute for Climate Impact Research. And she's working on food system transformation and what's needed for healthy and sustainable diets. On the screen shortly, maybe we can see Johan, is Johan Rockström, who is really an inspirational leader, first and foremost, an internationally recognized scientist. Hi, Johan. Welcome, on global sustainability and earth resilience. He has a lot of hats, but he is most notably director of Potsdam Institute for Climate Impact Research and professor of Earth System Science at the University of Potsdam. And last and definitely not least, Sam Myers here on my right to your left, who is the founder of Planetary Health Alliance and director of the Alliance, as well as the new Johns Hopkins Institute for Planetary Health, and has been a researcher on this interface for some time. So let's get down to it and dig into what it's really going to take. So Sam and Johan have put their heads together recently, and they have written fantastic commentary all about the connection between planetary boundary and planetary health. And that commentary has some real nuts and bolts in it. So I'd like first to go to Johan and just explain to us, Johan, what brought you to the idea and the reality of working on this with Sam and producing this paper. What was your intention with that?
Yes, thanks, Jane. And well, sorry not to be with you physically, but great to be joining this really important panel at this moment, this very important juncture. Sam and I think it's fair to say, Sam, we represent a much broader community, both from the public health side and from the Earth System Science side, that for several years now feel that we've come to a very important juncture where we need to have a much stronger intellectual, academic, scientific integration of the human health dimensions with the planetary health in the physical sense assessments. And as perhaps most of you in this room knows, it's in the last 20 years that we've been advancing the planetary boundary science, which is based on all the evidence of the great acceleration in the Anthropocene, all the evidence of the importance and stability of the Holocene, and the risks of crossing tipping points and causing irreversible undermining of life support systems on Earth. All of this has been biophysical natural sciences. It has been risk assessments, quantifying a safe operating space for humanity's future on Earth, but only based on assessment of the resilience and stability and the functions, the ecological functions of the Earth system. This has then been widened by bringing in social sciences also in terms of significant harm levels and justice dimensions through the work of the Safe and Just Boundaries, through the Earth Commission, but never really reaching all the way to human health. And at the same time, you have the Planetary Health Alliance charging ahead on addressing one of the most important questions we face now that we are not only in the Anthropocene, but now that we're so deep into global environmental change impacts on all facets of life, how that impacts human health. But nobody has mapped the human health impacts across all the planetary boundaries. And we've identified the 9 Earth system processes that regulates the stability and resilience of the Earth system. These are the 9 planetary boundaries. They're not only climate, but it's also fresh water, nitrogen, phosphorus, biodiversity, land, chemicals, stratospheric ozone layer, the ocean stability, aerosol loading. These are well analyzed from a natural science perspective. And there are so many elements of this from a human health perspective. And now we argue that it's time to join forces and develop this into a much more integrated planetary health science agenda, both for human health and for planetary health. And last week, to close this, Jane, we launched the 2025 Planetary Health Check, which is a scientific update, the natural scientific update on the planetary boundary science, showing that a 7th boundary has been breached. So now we have unfortunately reached a point where also the ocean acidification boundary is outside of the safe operating space. The Earth is losing resilience. We're taking big risks, and we're still following a pathway of danger. We haven't turned the corner, and we're not heading back towards a safe landing. And that's where I believe, if I close this on a personal note, that the human health lever is probably one of the most powerful ones to connect to people at the personal level, to be able to really engage and support an accelerated pathway away from danger. So those are a few remarks from my perspective, and perhaps over to you, Sam and Jane, on your side of what brought you to this collaboration.
Thanks, Johan, and thanks for still using an optimistic tone whilst telling us that we've reached yet another planetary boundary. Sam, let's hear from you, your side of coming together with Johan to make this commentary.
Sure. Let me start by acknowledging that it wasn't just Johan and I who wrote this paper. So we had roughly a dozen co-authors with us, many of them in the room today, without whom we couldn't have written the commentary that we wrote. So, and Oskar Masterlitz is here as well, who was shared the co-authorship for the first author of the paper. So this was a group effort. Why now? I think we heard threads of it all morning. We heard that we're facing geopolitical and corporate headwinds in addressing the Earth crisis, and that the urgency of the issues that we come here together around has never been greater. We heard a call for coalition building. We heard the need to integrate indigenous voices and knowledges to work across gender, across age, across geography. We also heard an important call. Michael Weatherhead emphasized to us the need to work across sectors and disciplines. And I think for me, one of the recognitions over the last 10 years has been the recognition that what I thought were a whole series of discrete and disconnected conversations, whether they were conversations about economic reform or climate or biodiversity or health or justice and equity, that they're actually one gigantic, interconnected, single conversation about whether or not we have a livable future. And in recognition of that, it becomes more and more paramount to integrate the conversation so that we don't have all of these separate communities advocating for their separate sort of perspectives and agendas, but that the economists who are thinking about the frameworks and the metrics we use to decide whether our societies are successful, and the earth scientists who are telling us about whether or not we're living on a stable earth system, and the health scientists who are thinking about our health and well-being, are all speaking with one integrated voice to say that we've come to live in a way that's choking the life out of our planet, and that we can no longer effectively safeguard human health into the future while the natural life support systems that we all depend on are now crumbling under the weight of our own ecological footprint. And so this is a first, and I think very, very important step in that coalition building and integration of these conversations, where probably the most respected global framework for thinking about the Earth system and Earth sciences that's developed over the last sort of 10 or 15 years, quite similar to planetary health, starting as a powerful framework and then being massively enriched with a deep evidence base, and then building a large human community around it, right? Similar to planetary health, that this is the first step of bringing those communities together. We're having similar conversations with the geophysical unions about bringing those conversations together, about the need to bring One Health and planetary health together, working with economies and Wellbeing Economies Alliance. So we need, as a group, to come together to highlight the urgency of the Earth crisis as a human survival crisis.
Thank you, Sam. And I'd like to turn to Lisa to get your perspective on this, because you're focused, I think, a large part of your work on the food system transformation. I mean, that's one system change where we really need society to come together. How do you see the framework suggested in this commentary as being helpful to that?
Yeah, thanks. Very good question. So I'll maybe start from my view as a healthcare professional. I think the Planetary Boundaries framework is extremely helpful there in using in communication. There are several considerations. First of all, we can look at each planetary boundary individually, and there are environmental changes associated with these Earth system processes. And all of these environmental changes do have adverse impacts on human health, right? So This is very well known for climate change. We've heard a lot about that already today. So increased heat mobility and mortality, increased allergy burden, severe weather events. But the same is true across all of the 9 planetary boundaries. So, for example, if we look at the novel entities boundary, we have thousands of chemicals with often largely unknown detrimental health effects. They contribute to cardiovascular disease, neurologic disease, impaired child development, and then for several other planetary boundaries, associated environmental changes severely affect food security and contribute to the global burden of malnutrition. So, for example, changes in freshwater cycles or loss of pollinators. We can, map across each planetary boundary really these detrimental health effects associated with the environmental changes. Then I think as a next step, what's very core to the planetary boundary frameworks is that these planetary boundaries do not exist in isolation, but there are manifold interactions between all of them. And so that accelerated change across one boundary will change risk levels for other planetary boundaries. So, for example, land use change, deforestation will drive climate change. Climate change, in turn, then will change freshwater cycles across the Earth. And the same is then also true, of course, if we take health into this equation. So there are manifold interactions between the health effects of these different planetary boundaries, so that accelerated change across one planetary boundary will exacerbate the health effects of environmental change associated with another planetary boundary. And at the same time, we know that intact natural systems are very important in protecting us from the detrimental health effects of transgressing planetary boundaries. So just a few examples. With increasing climate change, we see more and more wildfires, and these contribute to global air pollution, so to transgressing the aerosol planetary, or contributing to the aerosol planetary boundary. There's a recent publication showing that around 1.5 million deaths each year are attributable to air pollution from wildfires. Then we know that nature's contributions to people, which depend on an intact biosphere, are extremely important in mitigating, for example, detrimental health effects of climate change. So, intact forest cover will mitigate heat. Intact mangrove forests will protect coastal communities against floods and storms. And so these interactions really matter and should be considered also in the health context. And then, of course, lastly, what has been mentioned is that all of these 9 planetary boundaries, all these Earth system processes are essential to Earth system stability, keeping Earth in the stable Holocene-like state. That is the foundation for the development of human civilizations, and therefore also the foundation for human health and well-being. And so any large-scale disruptions to this system will mean, large-scale disruptions to health with unknown consequences. So tipping points have already been mentioned. We don't know what will happen in terms of health when we cross these critical thresholds that then trigger a large-scale, rapid change. So overall, I think all of these aspects are really important when considering the health effects of consequences of transgressing planetary boundaries. And so I think from a health perspective, it would be important to not only monitor planetary boundaries, which is now done on an annual basis, but we also need to monitor the associated health impacts, for example, by developing a planetary health dashboard.
Yeah, thanks, Lisa. So listening to Lisa, you get the feeling we already know a lot, but also that it's very complex. I'm pretty sure that Sam and Johan are going to tell us we don't know enough. We heard from Pim Martin this morning that we actually need some kind of new knowledge system to cope with these interactions, and perhaps that's what's proposed in your paper. I think there's a slide which shows these interactions visually, which might be, if we can find it, it would be handy to this one. Yeah, that's quite, without reading the detail on the right-hand side, you can see the connections are many. So I want to come to Johan and then to Sam, just to ask, Yeah, how is it going in terms of building this knowledge system? You know, how big are the gaps that we have, and what are the obstacles that we face to complete this picture?
Yeah,
Sorry,
thanks.
Johan.
I can start. Yeah, thanks. So just to start briefly, so to begin with, Lisa, you're putting your finger right at the heart of some of the scientific challenges we have on how interactions between boundaries amplify impacts on human health. As you point out, climate change, land system change with aerosol loading, for example, the premature death of 7 to 8 million people per year related to air pollutants, which of course has multiple planetary boundary transgressions as their cause. So that's one dimension here. The second is more basic, which is shown on this slide furthest to the combining the environmental changes with the proximate causes and quantifying for all the boundaries the human health impacts of the current level of breaching. We have, I would argue, data points that can help us essentially on each individual wedge, each individual boundary, but nobody has yet done the global burden of disease of breaching boundaries. There's been global burden of disease reports coming out from Chris Murray and his team each year. Perhaps several of them, colleagues from IHME, are in the room here. And to take the step to take a full Earth system, a comprehensive full Earth system approach when quantifying human health impacts, I think would be a very important contribution. And then bring that towards a deeper analysis of interactions between boundaries. So that's one step. But I think that what you and I have been discussing even more enthusiastically, Sam, is to do what Andy Haynes and colleagues and the Pathfinder Commission have been doing, to look at the synergies and the win-win outcomes of bringing us back within the safe space of planetary boundaries, and what those implications are for the benefits of human health. And that also requires more research. So it's both in the risk assessment and in the pathways towards a safe and healthy future.
Sami, would you like to add to that?
No, I think it's been pretty well covered by Johan and Lisa. I think the one other point that I would make that I don't think we as a community speak to enough, that's very clearly related to this conversation, is the invisibility of the pandemic that's being driven by the Earth crisis. So we're having all of these conversations about, the COVID pandemic, about, treaties around pandemic prevention, without real sort of recognition as a global society that, hang on, we're actually in the middle of a pandemic that we can barely see or measure, that in many ways is much more extensive than the COVID pandemic was, and that's causing very large burdens of disease across every one of these dimensions of health today. And yet, when a child dies in the East African highlands from malaria because warming has allowed Anopheles mosquitoes to move up in altitude, the death certificate says malaria, it doesn't say climate change, right? Or in the US, we've just learned that infant mortality rates have gone up 8% as a result of the loss of bat populations from white nose disease, which are causing farmers to increase their pesticide use by 31%, and the increased chemical exposures are driving infant mortality in those counties. But the death certificate probably says, failure to thrive or respiratory collapse or whatever it was. It doesn't say biodiversity crisis. And this is true across the world, that we're not seeing Earth crisis on death certificates, and we're not measuring it effectively. And because we're not measuring it, it's harder to manage. And so what Johan and Lisa are speaking to, and this idea of a comprehensive burden of disease assessment, I think it's the holy grail. I don't think it's possible today to do a full accounting of the burden of disease because there are many mechanisms we still don't fully understand. But even if we could account for the mechanisms we do understand that you saw sort of represented in this table, every single cell of that table is populated with evidence connecting each of the 9 planetary boundaries with every dimension of health. And if we started to do an accounting for that, we'd have a much better sense of what it's costing us as a global society in human terms. And that's what I think we haven't articulated as effectively as we need to. And then to Johan's point, we could do the really, really critical work of saying, what do we get if we start to reverse the Earth crisis, and to Pim's point earlier, to regenerate these natural systems, not sustain the status quo, but regenerate these systems, move backwards, and what is the benefit of all of that? So incredibly important to actually start to fill in these details with a comprehensive assessment of the health costs and benefits.
Thanks. So it's clear we already know enough to go into action. But there is a lot more that needs to be brought to light that is hidden. And one aspect of that I want to touch on next, the paper refers to as well, is the justice aspect, because these health burdens we know are not evenly distributed around the world, and we have disproportionate impact on the more vulnerable, and overconsumption and driving that impact by others in the world. So Lisa, maybe I can come to you first on this one. How do you see this justice dimension being incorporated in the work?
Yeah, I think justice is a very crucial point. I feel like it's also already been highlighted a lot today, that justice has always been center stage in the planetary health movement, and it also needs to be in this work going forward. So I think if we look at the Planetary Boundaries framework, we've learned that, this is really about tracking environmental changes at the global scale. So if we want to apply a justice lens, we need to break this down to more like the local and regional level, both when we look at drivers of transgressing planetary boundaries, and also when we look at the impacts of transgressing planetary boundaries. So for drivers, we know that it's actually like a smaller, wealthy part of the global population that's behind the majority of environmental changes. And then we do know that the impacts, and especially the health impacts also of transgressing planetary boundaries and destabilizing the Earth system, are not felt equally across the globe. But it is the most vulnerable countries, communities, and individuals that suffer the most, be it because they are more exposed, for example, in low-lying island states, be it that they are more vulnerable because of a low socioeconomic status, or they lack adaptive capacity on societal or individual levels. So I think going forward, justice really needs to be a cornerstone of this work, of assessing and then also addressing the planetary health impacts of transgressing planetary boundaries. Justice also needs to be first and foremost when developing, or needs to be considered when developing mitigation and adaptation measures. It's also crucial there. So yeah, I think it's central to this work.
And Sam, I think you might have some examples from your work where this justice angle comes in strongly.
Yeah, I mean, I feel like this is so self-evident to this community, but in our own research, we've done a lot of work showing how rising concentrations of carbon dioxide in the atmosphere make food significantly less nutritious and drive potentially hundreds of millions of people into micronutrient deficiencies. But when we did this sort of environmental justice analysis to ask which people around the world will be responsible for the CO2 emissions that get us to 550 parts per million, and which people around the world will suffer the nutritional deficiencies resulting from that increased CO2, we found that the populations were sort of mirror images of each other. And it's no big surprise, right? It's the wealthiest people in the world that are driving the CO2 emissions, and the poorest people in the world with the least dietary diversity and the least animal source food in their diet who suffer the consequences. And so that's often the case, right? That the people who are benefiting from the actions that are transforming the global environment are categorically different from the people who bear the burdens of those degraded systems, or people and non-human beings as well. And so there's this moral imperative to the conversation, and I think where it really plays out is what Lisa spoke to, which is when we think about the interventions to reverse those trends, we need to be absolutely certain that the benefits accrue to the most vulnerable populations first.
And Johan, maybe you'd like to add to that, perhaps also how we bring this science down to the regional level, and if you can also just to mention how the work on justice in the framework of the Earth Commission, the Earth System Boundaries, might be helpful in driving these changes forward.
Yeah, so let me complement what Sam and Lisa has pointed out here with three really exciting developments, I would say. I mean, number one is your point about scale, Jane, which is that the planetary boundary science is a global scientific framework. It sets the safe operating space for human life support on Earth, the stability and resilience of the entire system. But we also have a lot of methods and data today to scale that across all geographies and therefore also all societies across the world. So we're now working on developing what we're having as a working title, a planetary mission control center, where we connect each control variable for each of the planetary boundaries with global data sets from Earth observation data, ground truth on the ground. So you get down to the square meter sometime, but definitely acre level on nitrogen, phosphorus, fresh water, novel entities, land use, carbon, to be able to assess down to the local level both impacts in terms of, which has to a very large extent in terms of justice, because of Sam's point about the unfair redistribution of cause and effect, but also in terms of guiding investments towards moving back within a safe space. If you layer the boundaries at the local level, you can get much better assessments on the hotspot regions in the world for key interventions. So that's one capability we're developing very actively right now, to connect the global to the local. Secondly, it is exactly what you were hinting to, Jane, which is that the Earth Commission has for the first time used the same measuring units, so the same control variables. So if you talk about biosphere integrity and you look at extinction rate measured for how much can ecosystems tolerate before they tip over and collapse, which is the biophysical analysis of the safe operating space, the same metrics were used by social scientists to quantify the significant harm levels to people. So at what level of loss of biodiversity do you find evidence of unacceptable impacts on human lives? And this was not predominantly only done on health. It was done on water security, food security, labor productivity related to environmental conditions. And this was quantified for 5 of the 9 boundaries, just showing how complicated this is. But that's really exciting to measure safety and justice across the same metrics for all the planetary boundaries. This is a quest that is still going on, and the Earth Commission still continues working on it. And third and final, inspired by your intervention here, Lisa, as some of you in the room know, we launched this report earlier last week, the Lancet Commission report on healthy, sustainable, and just food systems, which is the 3-year Lancet Commission work, which has finalized its work, that also addresses justice for the first time to quantify the inequities in the global food system in terms of both impacts of unhealthy, unsustainable food, but also in terms of access to food and affordability of food and the rights to food. And this opens a whole new chapter on let's say, interdisciplinary research that I would argue connects the planetary health with the planetary boundary science. And that's again, charging ahead in one of the transformations, namely in the food system in this case.
Well, thank you for that explanation, Johan. This is really exciting. I mean, what we're hearing now is that it's really possible that in a short space of time, we really are going to have the knowledge that is integrated in a way that can be used, translated to a city, to a landscape, as well as countries. This is no longer something that's just floating up there all about the planet. This can be made very real and practical for action. But that brings me to the other two cornerstones, or legs, if you like, to the solution, which are mentioned in the paper. And they are perhaps the biggest bumps to get over, because one of those touched on earlier today is really about accounting for the costs of the degradation of the planet, at the same time as accounting for how that can be reversed when we do the right actions. So bringing these into the light and bringing them into our economic thinking and system. That's a very big ask, as we discussed earlier, but it's absolutely essential. And then communications, which has really been a theme from the beginning of the day. Getting the narrative right, really joining the narrative up and enabling the institutions to not stay in their separate silos, as Sam was saying, but really to embrace this collective narrative and to collaborate is going to need to happen. So the business case and the narrative need a lot of work, especially in the age of misinformation. So how are we going to make these shifts happen in the time frame that's meaningful? I'm going to come to you first, Sam. Put you in the hot seat.
Well, sure. So I mean, as you say, there were two other cornerstones to the commentary. One was about the need for sort of true cost accounting, and it speaks in some ways to the question that came up, several questions, I guess, that came up from folks on the virtual audience around capitalism and planetary health. And I would argue that we have all of these uncosted externalities associated with the way that we've come to live. And so when I say we're in this invisible pandemic, that's part of what I mean, is that, you know, if wildfires are causing a whole lot of morbidity and mortality, but we're not actually factoring that into decisions we make about land use, then they're not being appropriately captured, so we're not regulating. So for example, we did research in Indonesia showing that timber and palm oil in Indonesia were driving land use decisions that led to the haze episodes, and we quantified that there were 36,000 deaths on average every year from the air pollution associated with those haze episodes. We then showed that you could avoid 2/3 of that mortality with aggressive peatlands restoration, and so that intervention would save those lives. Once you actually quantify the cost in human lives of those industries or those practices, then it becomes very hard to argue at the policy level that these industries are making a lot of money for the government if the government is also meanwhile paying the costs of all of these health costs. And so actually making visible these externalities, you can make very similar arguments around the food subsidies we have in the United States towards, you know, meat and dairy and sugar sweetened beverages, right, that are essentially subsidized when they should be taxed if we actually factored in the true costs of those industries in terms of the healthcare system. And we should be subsidizing, you know, fresh produce, for example. And so getting the pricing right, apart from a conversation about capitalism, at least we need to factor in these externalities and get the pricing right. And of course, this becomes critical when we're contemplating policies at any scale, that so many of our policies, as Andy has emphasized and Pim has emphasized, those policies often have big co-benefits associated with them. We see it all around us here in the Netherlands, where you've got active transport and public transport systems and really creative waste management systems. Those are associated with really important co-benefits for the health of the population, yet they're probably not accounted for when we evaluate the costs and benefits of the policy. So we really, if we could start to factor those in, it would make so much of the policy that we need to get to look so much more attractive.
Yeah, exactly. Lisa, I think you have some examples of working with co-benefits as well.
Yeah, of course. Yeah, I just want to reiterate Sam's point that I also think that, you know, there would be huge strength in, you know, integrating communication from the Earth system science and the planetary health side to communicate the true costs and then the true benefits of staying within planetary boundaries. And I think a very good example is dietary change. I mean, as Johan mentioned, the Eat Lancet 2.0 report that was issued last week highlights this beautifully. So we know that without a food system transformation, or a food system transformation is crucial to halt the transgression of several planetary boundaries, because the food system affects many is a major driver across several planetary boundaries. And at the same time, we have these short-term health benefits there. The Commission now estimates around 15 million deaths per year that could be prevented if we had global adherence to the planetary health diet. So I think, and then this does not even yet entail the planetary health benefits, right? So the true cost. So I guess we maybe have to start talking about win-win-win situations there. And I mean, other examples, prominent examples are, of course, you know, phasing out of fossil fuels and preventing 5 million premature deaths that are related to air pollution from fossil fuels every year. So I think this is, health is really key to these communication efforts, and can incentivize policymakers to act, can increase acceptance also in their constituencies. Because health is tangible, it's personal, so we do know that this, you know, can be more effective than other narratives.
Yeah, and that could be very important, for example, for, as we were talking this morning about the development of new cities or extension of existing cities. You know, if the city planners and architects can understand how to factor in these win-win-wins, and make a business case for that, maybe then we'll really start to move this forward. I just want to give one final word on this topic to Johan, and then I'm going to come to any questions we have from the audience. Johan, would you like to add on this point?
I think Sam and Lisa have really summarized the action agenda really well. The only thing I'd perhaps like to kind of add as a broader framing is that I think we all in this room have a great responsibility to change the narrative, because we have had a dominant narrative over the past 150 years, which is we've had tremendous progress on human health. Amazing when it comes to the whole era of civilizational development, with all the science and healthcare and longevity and our abilities to improve lives for at least a significant portion of the world population. And admittedly, it has had a price tag, and the environmental price tag has been something that most in the mainstream have argued is a price you have to accept. It's something, it comes with the development pathway. And what we see over the past 30 years is that we've come to the end of the road of that journey, that actually the Earth system itself is sending invoices back right into the economy and hitting human health. That is no longer a win-win game. It's not any longer possible to unsustainably exploit natural resources for the sake of human development without the environment hitting back in terms of pandemics, or in terms of the 15 million premature deaths because of unhealthy food, or in terms of the 7 million premature deaths because of air pollutants, and so on and so forth. The latest assessment shows 2 billion people with life-threatening living conditions if we exceed 2 degrees Celsius of global mean surface temperature rise. 2 billion people, and I don't have to geographically place them. You know where they are. It's in the vulnerable tropical regions in the world. This is an unacceptable threat. And this just shows that we're so deep into the Anthropocene that there's no more room for the old narrative. And we need the new narrative, which is that a sustainable pathway is a pathway to human health. And it sounds so obvious and so basic for us in this room, so to say, but it's definitely not obvious out there in the global policy arena. And I think that is also part of the action agenda.
Thank you, Johan. So beautifully put. I'd like to, maybe we can restore you to the full screen again, and we can come to some of the questions from the audience.
Yes. Okay, so the first question we have here, how can we consider the health of non-human entities and our relationship with them in the Planetary Boundaries framework?
Who would like to pick that up? Lisa.
Yeah, I can maybe start. I mean, I guess Johan also has some thoughts on this, but this is a very important point. I think we need to also leave this anthropocentric view and also include other life forms. I think Johan briefly touched on this. The Earth system boundaries and this new framework that's been developed, and this builds fundamentally on the concept of Earth system justice, which includes different justice perspectives. So one, the intergenerational justice between different generations. So we also have to think about future generations, of course, intergenerational, so all of living generations now, but also then interspecies justice. So really thinking about other life forms, and I think it's a very, very important point to also consider this, and this is then also part of the safe and just Earth system boundaries.
Johan, would you like to add? Or?
No, actually, I was going to say exactly what Lisa said. It's really exciting that that we are adding the interspecies justice also in the just Earth system boundaries. So please check that out if you're interested. It's still in a qualitative stage. It's not well quantified, but it's definitely included in the framework.
Yeah, and that's another win-win, of course. Healing the nature will help to heal our society as well. Next question.
When speaking with people outside of our sphere, how do we counter the assumption that the changes in the Earth systems can't be stopped and we need to have more and more technology to just adapt to what's coming?
Yeah, I can start on that. That's a really important question, and the reason why I'm not with you today is that I'm sitting in Bonn with Simon Steele and the head of the United Nations Framework Convention on Climate Change, preparing for the 30th negotiations in Belém on climate. And as you may know in this room, we are forced today to accept that we are going to breach the 1.5 degrees Celsius limit, and we're heading into overshoot. And this is the best science can offer, an overshoot period to potentially come back to within the planetary boundary and a safe space by the end of this century, but that will have a 50-year period of 1.6, 1.7, perhaps even 1.8 degrees Celsius. This is danger. It will have even more extreme events, more fires, drought, heat waves, more impacts on people, on people's health. Coming back will require that we come back into the safe operating space of planetary boundaries to keep the carbon stocks and carbon uptake capacity intact, the resilience and health of the planet. This is a big question and big challenge. This is, of course, at risk to be hijacked by those who mean that, well, either arguing that we should therefore scrap the target, which I would argue very, very strongly that we should absolutely never do, because 1.5 is not a target, it's a limit, it's a boundary. We need to have that as our landing zone. But the other argument is exactly the point you're raising, that it opens up the door for geoengineering options. If we cannot phase out fossil fuels, if we cannot reduce the cause of the warming, can't we find quick fixes that could somehow, provide us with a faster pathway away from the risks? We see no such technologies that are scalable today without very dangerous side effects. We need carbon dioxide removal technologies. Those need to be scaled, but they have to be within the manageable, safe technologies like carbon capture and storage. So yes, we're in certainly for a dialogue here that will raise these questions, and I think we have to be very careful not to get caught up on a silver bullet type hope, which we do not see any evidence that it exists. We need to work with the planet, not try to escape from the planet.
Thank you, Johan. And I think maybe we've got a chance for one more question. Let's take that one.
It's a big one. If reversing breached planetary boundaries may take decades, what shorter-term indicators could help us track meaningful progress and detect early signs of positive change along the way, like actual indicators of regeneration?
Right, this sounds like one for Sam and Johan. This is all about the monitoring of progress.
Yeah, I mean, I think we are talking about continua. So, you can see which direction you're going on the continuum. And that's, some of these things, it's fairly straightforward. What does, global air pollution look like? You can measure that. You can see where you're going. You can calculate the burden of disease associated with that. So I think that in many ways is what we need. And I've been thinking about this a bit, this conversation about a dashboard. And I'm a tiny bit concerned that we're very fixated on a dashboard to sort of show ourselves how bad the problem is, this sort of trap of admiring the problem, and that in some ways alongside it we need a dashboard of solutions and progress. So what are the policies that are being implemented? What are the new practices that are being adopted? What evidence do we see of this great transition that ultimately we need in order to get to where we want to go? And just seeing the trajectory start to bend would be very encouraging. And we see that in many spaces. We see it around certain kinds of agricultural interventions, clearly with the renewable energy. I'm sure Johan can point to many more. So I think it's really seeing, evidence of change toward the progress that we need to be making on all of these different continua.
Yeah, I like that a lot. We need a dashboard of progress. There is a lot happening, and we need to celebrate it and inspire each other. Thanks for that remark. I'm just going to give a few seconds to each of the panelists to wrap this up. And what I'd like you to mention is, what would you see as a breakthrough result that would really signal a positive change in the next couple of years? What would that result look like? Maybe Lisa first, and then Sam, and then Johan.
Yeah, I think there's huge power in aligning the efforts of what we're trying to do here, aligning the efforts of environmental science and planetary health, and an opportunity to break the status quo. I mean, also relating to the question that was posed that, it's impossible to, stop breaching the planetary boundaries. I think, as in planetary health, we have so much power here to create a new narrative. And so my hope would be that, we can move forward with that and hopefully reach a place where we come to a planetary health in all policies approach, where this is really considered, in all policies everywhere. So I think that would be a huge step forward.
Okay, great, thanks. And Sam?
I'm going to say two things. One is, I think you're seeing it right now. So I think this sort of coming together of communities across the world and across sectors to share one voice and articulate one message that the Earth crisis is driving a global health and humanitarian crisis is a critical first step. And I think it is encouraging to see communities coming together. I think we then need to move from the sort of academic scientific community out into the world of policy and action. And what would give me hope, we'll hear more about at 3:30.
Okay. And finally, Johan, what would be the result you'd love to champion next couple of years?
Well, the first is absolutely what Sam calls a dashboard. I think if we can get the Earth system's health and humanity's health in one integrated framework where we quantify the safe and healthy boundaries and look at this both from an impact but also opportunity perspective, that would be groundbreaking. And then secondly, I think if we can help each other to get the scientifically correct narrative to become viral across the world, that transitioning away from environmental risk at the global to local level is a pathway to a more secure, healthier, peaceful, prosperous, and much, much more attractive future. The narrative that this is the winning path and it's not a sacrifice path. And I think if we can help each other there through all the evidence we're sitting on, I think that's a breakthrough.
Wonderful. So it's in our hands to get these results in the next couple of years. I would just like to ask you to join me in thanking this wonderful panel. Thank you so much.
Thank you so much. And I would ask for you just to stay on stage for a moment to take a picture. I want to really thank you all for that amazing panel. And if you're sitting here in the audience and you're saying, what is in my hands to do right now? One thing that's literally in your hands is, I'm sure, many electronic devices. And we saw that screen earlier that talked about the science, the literature connecting the planetary boundaries to health outcomes. If you know of additional literature that not only describes that, but hopefully, as we were talking about, the solutions that go along with that, you can submit them to the resource library that the Alliance hosts. So you can find links to that on our resource page. And we encourage each and every one of you to help us make sure that we are collecting all of those stories of impact. But thank you so very much to the panel. Yes, so we do not have a break now. There are no breaks for everyone. We want to power through this together. But we do have a really exciting session now that really is going to focus on, again, those solutions. I lost the crowd. It's solutions, everyone. Oliver might want that. That works. Okay. All right. We are really excited about this next session. Many of you were with us in our last annual meeting that was held in Malaysia, and you remember that collective action where we came together and launched the Planetary Health Roadmap and Action Plan. And here today, we're actually going to hear more about that progress on that action plan. And this is a progress that comes from our entire community. We've had so many individuals from across the globe who've been working with us on this over the past 18 months, and here is a session to really celebrate that. So I will invite my panelists to join us. We will be hearing first from Professor Tan Sri Dr. Jamila Mahmood, who's the Executive Director of the Sunway Center for Planetary Health at Sunway University in Malaysia. She was the co-lead of the program committee for the annual meeting. We had the pleasure of working with her then. She has more than 2 decades of experience managing crises in health, disasters, and conflict settings. She's going to pull me off the stage if I say anything else, other than that she is a huge champion for the planetary health, planetary health movement, and we're delighted to have her here. And she will be joined by her colleague, Oliver Lacey Hall, who's a strategy advisor at Sunway Center, and then by my dear colleague, Tulsi Modi, who you've already seen doing 9 million things here, because that is what Tulsi Modi does, 9 million things to help our community. So over to you all.
Thank you very much, Jess. Yes, I was going to pull you off the stage. Hello, everyone. It's lovely to see all of you again. And it's really great to be with you today, reflecting on all that has happened since we last met in Kuala Lumpur last year. And the last 18 months have just been extraordinary. They have been turbulent, at times exhausting, and yet filled with moments of progress and hope, and a lot of friendship, I would say. We gather here not only to celebrate what has been achieved, but also to remind ourselves of the scale of the challenge still before us, and of the courage and conviction we will need to meet it. Let me first of all begin by extending heartfelt thanks to Erasmus University, Kara, for your amazing leadership and work in hosting us here in Rotterdam, and to the Alliance, of course, for making sure that we get together regularly. From my own experience in Malaysia last year, I know just how much effort, care, and commitment it takes to bring a community like this together. So you have done it with generosity and purpose, and we're all very grateful. Last year in Kuala Lumpur, we challenged ourselves to confront reality. We spoke of moving from evidence to action. This year, our task is to act with urgency and agency for systems change. It is the natural next step, but also a daunting one, because systems change is not about incremental tweaks or marginal improvements. It's about rethinking, redesigning, reimagining the foundations of the way we live. It is about courage. It's about persistence and imagination, or as my Sarah puts it, being incredibly annoying. And above all, it is about recognizing that the responsibility belongs to all of us. The urgency couldn't have been clearer. July 23 was the hottest month in recorded human history. From June 23 to May 2024, every month set new records for global heat. We are now living in a world that is consistently warmer than 1.5 degrees above pre-industrial levels, as Johan has also illustrated to us. Now, 1 in 4 deaths worldwide is linked to environmental risks that are preventable. 1 million species face extinction. You've heard all this before. They are not just numbers on the chart. They represent lives cut short, futures diminished, ecosystems unraveled. They are our families, our neighbors, our communities. And as Johan presented the harsh reality now, we have crossed 7 of 9 planetary boundaries. This is why urgency matters. But urgency on its own is not enough. A sense of crisis can wake us up, but it cannot sustain us. Urgency must be matched with agency. Momentum requires people, and a movement cannot rest on the shoulders of a few. It must be carried by many. At FAM 2024, 6 working groups were formed under the Planetary Health Action Roadmap, or Roadmap Action Plan, and they were filled with enthusiasm at the onset. But over time, participation slipped. That is not unusual, but it is telling. It reminds us that true movement building depends more than a burst of energy. It requires shared ownership, collective responsibility, and sustained commitment. And yet, even with these challenges, much has been achieved. And those achievements are worth celebrating because they are proof that with determination, progress is possible. Together, we developed a composite index to measure planetary health across human, environmental, and social dimensions, which you will hear of later this week. Internews, our partner, carried out a global stakeholder mapping and analysis. It showed us what many of us already suspected, that planetary health is still being discussed in fragmented ways. It highlighted the need to engage far more actively with stakeholders and influencers outside our traditional circles. Playbooks have been produced, monitoring and evaluation frameworks created, and new tools prepared to track our journey forward. We launched a network of journalists across Asia Pacific. More than 120 media professionals are now connected, and 6 organizations work together to train them in planetary health. The interest was overwhelming. Each of the 4 workshops attracted upwards of 250 applicants with only space for 30? Clear evidence that there is hunger for knowledge and stories that connect people with these urgent issues. In education, we finalized new curriculum guidance, a policy toolkit, and storytelling materials. The Let's Teach Planetary Health webinar mobilized educators globally, proving that teachers and students alike see planetary health as central to learning. In global governance, we invested in building the capacity of the Planetary Health Alliance members to engage in multilateral processes. Many who had never set foot in an intergovernmental meeting are now able to analyze legal text, navigate diplomatic arenas, and turn passion into effective advocacy. In business, we convene small, medium enterprise and multi-stakeholder groups, laying the foundations for leadership programs that can help shift the focus from return on investment to return on values. The mainstreaming group developed the Planetary Health Handbook and Toolkit, and a new working group was launched on AI and innovation to ensure that technology is used wisely and responsibly. With thanks to our friends in Latin America, the roadmap has been translated into Spanish and Portuguese, and by our center into Bahasa Malaysia, and we want to ask for many of you to step up if we can start doing this in French, Arabic, Chinese, Russian, all the different UN languages. And crucially, we also adopted the Sunway Charter for Planetary Health, or the Faith Charter, reminding us that values, ethics, and spirituality are not afterthoughts, but central to our collective response. And then there is my country, Malaysia's bold step forward, inspired in part by the momentum generated at FAM 2024. Malaysia is launching the world's first national planetary health action plan. It's pioneering, it's ambitious, it's bold, and it's already encountering economic, political, and social challenges. But it is real, and I will invite you to think of Malaysia as a planetary health laboratory, a place to test, to learn, to innovate, a place from which the whole world can draw lessons, inspiration, and courage. And we're very fortunate to have with us later to speak Emeritus Professor Dr. Asma Ismail, who leads the Malaysian Academy of Science Working Group, walking us through this together. Now, this is an impressive record that our community can be proud of, but we must not be complacent, because the truth is that momentum is fragile. The coordination of this work so far has been carried heavily by 5 organizations: the Planetary Health Alliance, the Pacific Disaster Center, Georgetown University, Sunway Institute for Global Strategy and Competitiveness, and our Sunway Center for Planetary Health. Each has given time, resources, and leadership. At Sunway, we have invested heavily in governance, communications, and business engagement. Georgetown has nurtured early career researchers, and the Alliance Secretariat has led in education and mainstreaming. PDC has steered the measuring work, and beyond these, more than 100 volunteers from across the planet offered their time and expertise. But we cannot build a momentum on 5 sets of shoulders or on voluntarism alone. If systems change is our goal, then the responsibility must be shared more widely. It must involve everyone here and far beyond this room. And we must also confront the world around us with honesty. The global political environment is deeply challenging. Rising nationalism, intensifying polarization, resurgence of autocratic behavior in some states are all making international collaboration harder than ever. These trends have the risk of fracturing alliances, slowing progress, and can leave us feeling demoralized and battered. But let me say this clearly. This is not a reason to stop. Quite the opposite. When the political environment is hostile, when hope feels thin, this is precisely when courage is most needed. And this is the moment to redouble our efforts, to seek resources with creativity, to innovate, and when required, to be outspoken and annoying. Our messaging must be clear, focused, strategic, and challenging. And as we have heard from the many experts and speakers already today, the stakes are just too high for timidity. This is not a time to retreat. This is a time to act together with greater conviction. And as Nobel laureate Maria Ressa from my region said at the UN General Assembly last month, choose courage over comfort, facts over fiction. If planetary health is to matter, it must go beyond the halls of academia. It must show up in boardrooms where economic decisions shape the future. It must be present in parliaments where laws and budgets define what is possible. It must be in classrooms where new generations are forming their values. And it must be lived in communities where resilience is tested daily. And if we remain only within our comfort zones, speaking only to each other, we will fail. So we must push ourselves into new spaces. We must ask the hard questions. What do interacting planetary boundaries mean for people, for communities, for systems of governance? Which systems collapse when another falters? And who do we fail when we fail to act? These are not academic questions. They are existential ones, and they must guide us. The tools are ready. The evidence is overwhelming. The reality is undeniable. What remains is courage, creativity, and collective action. And these are the ingredients we must bring into the workshops and discussions here in Rotterdam. It would be a tragedy if we left this gathering without using the frameworks and tools devoted and developed with such commitment over the past 18 months. So my call to you is this. Let us celebrate what has been achieved. But let us be braver, bolder, and more united. Let us push beyond safe conversations and take planetary health into spaces where it has never been heard. Let us show by our actions that urgency can be matched by agency. When we leave Rotterdam, let us not leave as advocates alone. Let us leave as living examples of planetary health in action. Because of the health of people and the planet and all living things on it depends not only on what we have said here today, but on what we will choose to do tomorrow. Together, we can make planetary health real. Together, we can ensure it becomes not just an aspiration, but our legacy. And we must believe in hope. I was reminded that Martin Luther King did not inspire people by saying, I have a nightmare. And Jane Goodall, right to the end, reminded us on the importance of courage and hope. Thank you very much, everyone.
Gosh, how to follow that? Jamila, thank you very much indeed. Ooh, just get this the right height and see if the clicker works. Where do I point it? Oh, great. All right, thank you very much indeed. So Jamila, thank you very much indeed for kind of laying out the broad framework there. From my perspective, it's really nice to be back here a year and a half after we all met in Malaysia and give you a report back on some of the work that's been going on over that time. I'm going to do that together with Tulsi because PHA and the Sunway Center for Planetary Health have been working very closely together on kind of guiding this whole roadmap process. Let me start really by saying thank you very much indeed to the leaders. Jamila touched on who they are, the Planetary Health Alliance, the Pacific Disaster Center, Georgetown University, and what I think we can call the sort of Sunway University family. And of course, the many, many people in this room and who are not in this room who got up early in the morning or stayed up late at night to join and attend the meetings that have brought what we're going to describe now to life over the last 18 months. This is really just a taster. There are sessions on all of these, the work of all of these 6 working groups taking place over the next 2 or 3 days. So really this is just to give you a taste of where we're at. As Jamila said, the roadmap identified 6 areas of work where progress would make a difference, and Tulsi and I are going to run through those now. So let me start with measuring, and we're trying to sort of describe what we've done against what the action plan called for, and what we hope will happen next. But our hope on what happens next very much comes down to people who are here this week saying you're going to join us in that process, that you agree with where this is going, and so on and so forth, which is what the smaller groups are for. I think we all agree that, and I think Johan and colleagues in the previous session made it really clear, and Sam, of course. Measurement is really the foundation of progress. We can't manage what we do if we're not able to measure it. Okay, thank you very much. And so Pacific Disaster Center and the Sunway Center for Planetary Health have led this group of people on developing a global metric and a national level composite assessment. Those have been completed in what I think we can call a sort of first go format, and the results of that will be released and discussed tomorrow at the session that's going to be held on measuring planetary health. So we have some tools now to monitor progress, to identify gaps, to adjust course, as well as the beginnings of dialogue across groups who are working in this field. So next steps are that the initial assessment will be published, will be peer-reviewed, and we would like to make sure that as part of that process, conversations start with Johan's team and others who are kind of looking at various aspects of this kind of measuring. And I think also look and see if there are ways in which we can perhaps use Malaysia or other countries to start thinking through building capacity so that countries can apply this kind of evidence directly to policy. I think the goal is pretty simple. It's consistent, transparent data that drives real decisions. Second is, yes, communications, which I have I've had the pleasure of leading over the last 18 months. A very active working group, lots and lots of meetings since we really kicked off in September last year. I guess the key element is the delivery of the Voices for Planetary Health report, which we commissioned through Internews. Thank you so much, Internews, for the amazing piece of work that you've done there. That consists of a research document, 9 playbooks for how we can start to engage fairly systematically on communications with particular stakeholder groups. I think a copy of that was passed to everybody who's in this room today, so if you haven't had a chance to look at it yet, please do. Kind of beyond what we were asked to do in the roadmap, which was really come up with a kind of global communications plan, and I think we've got some of the nuts and bolts of that. There's been some additional activity going on around training media professionals in Southeast Asia. We've run 4 workshops over the last 18 months, training 120 journalists, and from that pulled together the beginnings of a media professionals network, which has a Google Drive, a WhatsApp group. We are starting to really see the benefits of people communicating across that. More on that on Thursday. And also included in the National Planetary Health Action Plan, which you will hear about shortly, is a really clear set of plans around behavior change and communications. And we hope that we can, as Jamila has said, use Malaysia as kind of the test case to help build this stuff out more broadly across the planet. Next step, hopefully we can identify somebody to take on the leadership of the communications working group. I think, the sense is that these things should to a certain extent rotate. We want to see how we can use the playbook, standardize those across the regional hubs and across the members of the Planetary Health Alliance, some discussion there. Find money, if we can, to roll out media training in other parts of the world, and do the same with the journalist network, and maybe webinars based on what is happening in Malaysia around the implementation of the National Planetary Health Action Plan. Next area that we've been working on is governance, really focusing on providing this capacity building that Jamila has talked about for PHA members. On global governance. We've focused a lot also on young people, on youth, training them in governance skills via the global governance strategy, and tried as much as possible also to ensure that we've kind of got joined up coverage across the global range of intergovernmental meetings. There's been a case study on the World Health Assembly, on the UN Ocean Conference, and the UN climate change meetings. And also we developed a theory on international law, global governance, and diplomacy for planetary health by really sort of quite carefully tracking negotiations and evaluating inflection points. Where we want to go next, I think, is looking at who's leading this and how is this being led, which organization should be front and center on this. Real focus on education, on training courses on global governance for planetary health. And see if we can get some kind of centralized platform set up to track intergovernmental negotiations and develop related communications campaigns. We talk about the need for a systems-level approach. Sadly, global governance is as siloed as anything else. From my side, we also have been working on the issue of balancing business and planetary health. This came up very strongly. We had quite good private sector engagement at FAM 2024. And out of that, we have had the work being done by the Sunway Institute for Global Strategy and Competitiveness around engagement with the private sector. They've engaged with 26 small, medium enterprises across sectors, including pharmaceuticals, textiles, agriculture, and the team has designed a planetary health training program for SMEs, while the already established leadership training transition program has reached 165 executives from 59 companies. And that's across plastics, electronics, chemicals, and education sectors. And I think starts to show that transformation can be mainstreamed across industries. The aim is that we expand this project regionally across, at the moment it's in Malaysia, we expand it across ASEAN slowly and carefully, and extend engagement to larger corporations and their supply chain. There'll be careful documentation of what's going on through case studies and through continued leadership right the way through the end of 2027. And then finally from our side, and I know this has kind of been very much on the agenda in everybody's minds, I think, artificial intelligence. And we kind of realized that this was becoming quite important since the last Planetary Health Annual Meeting. And there, we went out to the group and everybody agreed that we should have a working group looking at artificial intelligence. So that was set up in June or July this year. There's nothing really in the action plan around artificial intelligence, but we've started to put such stuff together, i.e. the establishment of the group, pulling together some core messages for public and business audiences on something called pro-social AI for planetary health, more of which you'll hear about during the course of this week. We've done a sort of stakeholder mapping across Malaysia, and we're beginning that for ASEAN. And in order to try and get our ducks lined up and our thoughts sorted out, started the work on a white paper looking at pro-social AI for planetary health in Malaysia, and a strategy outline for a broader piece of work on that, looking at where we go next. So for the next steps here, continue the AI working group through 2026 and hopefully 2027, looking at really kind of developing positive use cases for this pro-social approach to artificial intelligence. We recognize the need to start developing a suite of knowledge materials for educators, for youth, and for critics as well, and to really move this whole process forward, more of which you'll hear about during the course of this week. From my side, that's it. Tulsi, over to you. Thank you very much indeed.
Thank you, Oliver, and thank you, Jamila. I've turned my phone on Do Not Disturb, so if you're sending WhatsApp message, I'm not looking at them right now. So I want to talk a little bit about education. So one of our working groups, education led by my colleague Jelena, has been developing, and a lot of this is available on the PHA website now, quite a bit of deliverables. So I'm going to, Jamila kind of gave the teaser, I'm going to give the trailer, and then you can see the full Christopher Nolan type movie at the education session on Thursday. So one of the big outputs of this are 3 videos on the global nature of planetary health. Each of them are about 8 minutes, and they focus on different things. They showcase diverse perspectives on global and environmental crises, highlighting the interconnectedness of planetary health challenges. So they're organized into 3 themes: personal experiences, awakenings, and planetary health success stories. And these stories are designed to spark constructive conversations about planetary health challenges and serve as powerful resources that can be used in classrooms and beyond. The second output that I really want to highlight here is a policy toolkit. And all of these are also on the website. And it'll be launched with an explanatory video and introduce a crowdsourcing component. This is a hands-on resource that helps educators translate planetary health concepts into scientific evidence, into clear and actionable policy briefs. And then the third is one that Jamila mentioned earlier on about this webinar that we just had this overwhelming interest of over 250 participants, mostly from higher education. And the goal is to reach more primary and secondary educators. But this team intends to continue this series beyond FAM. The webinars are created to be inclusive and accessible and welcoming to educators across disciplines and geographies. So they introduced foundations of the Planetary Health Framework, they shared open access teaching resources, and gathered input from participants to inform the future educational initiatives. And then I want to talk a little bit more about mainstreaming. So this was our 6th working group, and much like roadmaps and much like plans, it all requires a little bit of updating. So while we set out to make this an independent group, what was really amazing was to see how each of our working group leads, the measuring, the communications, business, governance, and education, took on mainstreaming within their own line of work and their own responsibility. So the work that I was doing was actually becoming quite redundant because they were taking charge, and that's really a testament to what should be happening. So while they were doing that, some of the work that I worked on with the mainstreaming group was reaching out to the planetary health community and to showcase how different initiatives, different groups, and organizations have mainstreamed planetary health in their own communities. And we have published some of those exciting initiatives on the PHA website that you can refer to. But it just really shows that there are multiple paths forward and there's multiple ways to mainstream planetary health, and they differ globally, and we want to embrace that. And with that, I want to, again, just plug in the upcoming parallel sessions that we have. So you can see here some of the upcoming sessions this week. Please look over the schedule and the agenda and attend them. This is where you're really going to get into the weeds of what they've been doing and what action is still remaining and where they are going next. That's it. Got it.
All right, nope.
No, wait.
Back to your chair.
Oh.
Sorry, you can't get away back.
Thank you so much. You too.
Me too?
Boy, it's an unruly group. All right, thank you so much for really an amazing kind of explication of all of this incredible work that got started in Malaysia and has carried on since, and all your leadership in making that happen. So you guys have to stay here for photos. Are the photos done?
Not yet.
All right. In the meantime, I get to preview the next session, which will be short but immensely exciting. When Jane was asking me what would give me hope, this is one of the things that I was thinking about. I see it as a huge advancement for the global field. We've heard a lot about siloing, and Oliver just mentioned that the policy community is also siloed. I remember a conversation that I had with Ava Richardson, who's here from Baltimore and runs the sustainability office at one of our dinners last month, where she was describing trying to develop commitments to decarbonize Baltimore as a city, and the challenge when they actually sort of did an accounting of the jurisdictions that would be relevant in trying to carry out those commitments, and it's something like 16 different jurisdictions that were relevant. And so the challenge of actually making progress with something as holistic as planetary health when our policy is done in these very discrete silos. And so efforts in the policy space to impose a more holistic framework and a sort of all-of-government framework to achieve some of our goals are few and far between, and it's incredibly exciting to watch them slowly starting to emerge. There have been, in addition to, I guess now we can let Tulsi and Oliver move along, but we're going to keep Jamila here, and we're going to acknowledge her leadership in this exciting development. We're going to invite Asma Ismail to join us on the stage, and Puan Hazami Habib, who's CEO of the Academy of Sciences as well. Both completely critical to this action plan. Please join us. Also want to acknowledge that two other people who were very critical to this process and who we're honored to have in the audience with us. In addition, oh, I'm sorry. And then, wait, I'm getting all mixed up. So we have Chong Li Kang, right? No, and they're joining us remotely. So hopefully they're with us on video. The Honorable Chong Li Kang is the Minister of Science and Technology and Innovation from Malaysia, so we're hugely honored to have them. And then also Horjio Wei, Senior Analyst from the Academy of Sciences, I believe is in our audience and was very integrally involved. So anyway, we're super, super excited to hear more about this big announcement.
Thank you very much, Sam. Now, I won't take much time, but it just gives me such an honor and privilege to invite a woman that I always say when I grow up I want to be. Emeritus Professor Dr. Asma Ismail, who is not just a brilliant scientist, but was our former Director General for Ministry of Education, Higher Education, but also a former National Science Advisor, and many, many, many other things, right? So the one piece of advice I will give to all of you is if you're passionate and annoying like me, then you need to find somebody who will actually get the work done. And that is Professor Asma in our case. She has not only led the steering committee for the National Planetary Health Action Plan, she has also led the work on the National National Higher Education Blueprint, which will have planetary health being mandatory for all universities in Malaysia. And she told me yesterday that she's also leading now the educational reform for Malaysia, which will then have planetary health from K to 12. So without much further ado, please welcome my hero.
Can I have the slide? Okay.
Do you need help?
Yeah, I'm fine. No, I'm fine. Okay.
Do you want me to work the slides for
No,
you?
I'm fine.
Okay.
Right. First of all, I would like to thank Tan Sri Jamila for the gracious introduction. And I also like to thank the organizing committee for inviting us to be able to share our plans to move the whole country on planetary health. This is what we want to share with you, the National Planetary Health Action Plan to move Malaysia as a country towards making the planet a better place. Just to share with you the commitment of the country towards this effort, how we have embedded policies, strategies, action plan to move Malaysia as a whole to make us a better place. I will now share with you the plenary address by the Minister of Science, Technology and Innovation, Honorable Chan Li Kang. Why is it not showing on my slide? Okay.
There you go. Yeah. So you can klik sekali lagi. Technology. Okay.
Yeah.
Sound engineers.
This
is the volume up?
Good day to everyone. It is an honor to join. Excellencies, members of the Planetary Health Alliance, distinguished guests, ladies and gentlemen, a very good day to everyone. It is an honor to join this important gathering virtually and to reaffirm Malaysia's commitment and vision to advancing planetary health for a sustainable and resilient future. At the Ministry of Science, Technology and Innovation, MOSTI, we believe that science, technology and innovation are the driving force in addressing the planetary health crisis. Just as STI powered Malaysia's rapid growth, it must now be at the forefront in tackling climate change, biodiversity loss, pollution, and emerging health risks. This is why MOSTI is prioritizing 5 focus areas aligned with planetary health. Hydrogen as a cornerstone of clean energy and the low-carbon transition. Artificial intelligence for smarter, data-driven decisions. Biotechnology to protect health, biodiversity, and food security. Aerospace and satellite technologies to track climate risks and natural resources in real time. Last but not least, a vibrant startup ecosystem to accelerate green innovation. Indeed, advances in genomics, geospatial mapping, AI, and green technologies are already transforming how we monitor ecosystems, predict disasters, and build resilience. The challenge is not generating knowledge, but applying it systematically, responsibly, and inclusively to serve both people and the planet. From the Nipah outbreak to COVID-19, we have learned that crisis can disrupt every sector, the economy, education, and social stability. The question is no longer whether another crisis will come, but whether we are prepared with the right science, technology, and innovation in place. Distinguished guests, ladies and gentlemen, guided by this conviction, our National Science Council, NSC, chaired by the Prime Minister, decided right after COVID-19 in 2021 for MOSTI, in collaboration with the Academy of Sciences Malaysia, ASM, to develop the National Planetary Health Action Plan. This blueprint, grounded in years of evidence, is designed to balance human well-being, environmental sustainability, and economic resilience. The plan positions Malaysia to harness STI's full potential by integrating green technologies, biodiversity, and genomic databases, advanced data systems, and innovative governance models. It ensures that our research solutions are sustainable, science-driven, and future-ready. Anchored on 6 key result areas and 5 systemic shifts, the plan redefines progress beyond return on investment (ROI) to also embrace return on values, healthier people, stronger community, greener ecosystem, and long-term resilience. Under the 13th Malaysia Plan 2026 to 2030, we are embedding planetary health principles into development priorities, strengthening environmental governance, building climate resilience infrastructure, and safeguarding biodiversity. Complementary policies such as the Malaysia Blue Economy Blueprint and the National Education Reform further align our economic and education systems with planetary health goals. Distinguished guests, ladies and gentlemen, we know this is not a journey Malaysia can take alone. Planetary health transcends borders. It demands collaboration, shared responsibility, and knowledge exchange. That is why Malaysia actively engages with global partners, including the Planetary Health Alliance, to co-create solutions and mobilize collective action. On behalf of Malaysia, I thank the organizers of the Planetary Health Annual Meeting 2025 for recognizing our efforts. This honor strengthens our resolve to stand with the global community in safeguarding the health of both people and planet. Let us act with courage, responsibility, and unity for a healthy planet, healthy people, and a prosperous future. I wish all of you a successful annual meeting ahead. I now invite the chairperson of the NPHAP to elaborate further on the action plan. Thank you.
I will now deep dive into the plan. Basically, what the front cover is showing to you is a near extinct plant called the begonia species, right? And it's side by side with the most advanced in terms of development, which is Kuala Lumpur, The question is, how do we balance between a clean environment, but at the same time, progressive city? Because Malaysia is at a turning point. We have, if you look at the progress across the sustainable development pillars from 2000 to 2019, Malaysia experienced steady economic growth. So basically, just pay attention to the blue line. And you see that we have now faced from 2000 to 2019 a very progressive economic growth. But from 2000 to 2010, STI seemed to be plateaued. We seem to be stagnant in using STI to move our solutions. And we find that by looking at this, we now see that our economic progress is at the expense of environmental development and at the expense of social development. And if we look at our Malaysian Environmental Performance Index, from 2012 to 2022, we have gone from number 25 to now number 130. We are at a turning point. It does call for action to take place. And basically, what is the cost of doing nothing? We ask that question, right? But the cost is going to be expensive for us because by 2019, premature deaths linked to environmental issues cost Malaysia USD 15.86 billion, which is about 5% of our GDP. And between 2005 to 2022, these costs now have grown to now 161%. So at the Academy of Sciences Malaysia, we say that we have examined this post-COVID, and we then say, okay, the combination of academic science 4 papers on precision biodiversity, on climate change, on Science Outlook 2020, and on zoonosis revealed critical insights into outbreak risks and impacts, underscoring the need now for a forward-looking action. So in response, the proposal, that's how we got together and said, okay, the country needs to have a proposal for a national planetary health action plan that was tabled at the National Science Council, chaired by the Prime Minister on the 4th of April, 2022. The National Science Council then mandated MOSTI, which is the Ministry of Science, Technology and Innovation, through Academy of Sciences Malaysia to actually lead the development of the action plan, but this time around, grounded in science, technology and innovation with, of course, never working in silo, but working now with central agencies and key ministries. This is the plan. This is the framework that I would like to share with you today. Basically, when we first started this, we say we gotta have what is the grounding principles of doing this. So we then say there are 4 principles that we now hang on to, which is humanity-centric, not human-centric, humanity-centric, STI-enabled, nature-based, as well as values internalized. What do we mean by this? Basically, when we talk about humanity-centric, all right, that is placing people, especially the most vulnerable, at the center of every decision. But when we talk about humanity-centric, it's not about human-centric. When we talk about humanity-centric, we have to now take care that the decision we make now also must be planet-friendly. The next one, to have science, technology, and innovation enabled, meaning to say harnessing STI, levers for resilience and sustainability. Nature-based, valuing ecosystems. It's high time we now value the ecosystems as critical infrastructure for health, security, and well-being. And this time around, values internalized, not just values-based, but values internalized. So that now we can embed the universal spiritual values, the indigenous knowledge, the ethics, the intergenerational justice in all of our policy as well as planning. STI, it must be an enabler, because for these principles to be successful will require strong enablers, and STI now stands at the forefront, linking human health ecological systems, and driving faster, more sustainable progress across the 5 areas. These are the 5 areas we are going to use STI. Number 1 is, of course, for data and monitoring, improving prediction, because with artificial intelligence, we can now predict. So improving prediction, evidence-based decision-making through advanced data systems and AI. We are also using this for technological innovation so that we can scale up nature-based and green technologies, because this is where we want to go forward, that advanced startups and whatnot in green, using green technologies that advance sustainability and health. Interdisciplinary research, this is a must as far as grants from the government is concerned. Fostering collaboration across STI, across policies, communities, business, and to co-create holistic solution. Policy and governance, we need to embed STI insights into the national framework to ensure inclusive, transparent, and adaptive governance, and local and global collaboration, building partnerships for knowledge exchange, technology transfer, and capacity building, especially for the vulnerable communities. Now, as you now see, anytime you want to address planetary health problem, like it or not, we will have experts working on environment and health. We will have sustainable food, research and education, energy transition, governance, and for the first time, led by Tan Sri Jamila, we now have values, culture shift of society, behavioral changes, and communication. If we leave them alone, they will still now be working in silos, because that's what we are used to. And so we say to ourselves, we can't do this anymore. We can no longer work in silo. Because the way to solve planetary health problem is to have interlink, because all of these are interdependent and interlinked. So now how do we now make all of these people, the experts now, to make sure that they are not working in silos? So it's very important that each of the key results areas are not implemented in silo, and they need to be interconnected to ensure coherence and integration. And how do we do this? This is the change that we have now undergone. It's not easy, ladies and gentlemen. I've got 70 people who are experts in their areas, all saying, what is it now you're saying? All right, so basically, they have worked for environment, health, sustainable food, all these pillars, and they have come up with their strategic plans and action plans, right? Now we are saying, hold on, we need to link all of this together so that now it makes sense, because nothing works in silo. So what holds these pillars together now is the 5 systemic shift. That is the new change that we now brought into the plan. And this shift is to, number 1, strengthen governance and management of the nation's natural khazanah. Khazanah here means our natural ecosystem. We gotta respect that. Secondly, to nurture people to lead a healthy, prosperous, and values-driven nation. Third, to have planet-friendly business, effective communication, behavioral and values mindset, and sustainable financing and resource planetary health development initiatives. So all those strategies that we have under the key results are now synthesized, synchronized, and held together by the 5 systemic shifts. And with that, we finally align and come down to 53 strategies and 222 action plans. But to make this thing into operation is not that easy either, because leadership is muy importante. Right? Basically, now we say we need to have a transformation, sustainable leadership, because there are many leaders, but they are not naturally trained in sustainability. And therefore, we need to have that. The next one is to have an impact tracking framework regarding what we are doing, so that we now know on the fly what is happening regarding progress. And of course, now to have an environmental genomic database framework. But today, we were all talking about how do you balance between economy as well as planetary health. And that's why we say to move all of this, to bind all of this together, is to not talk about return on ROI, but rather to talk about ROV, return on values. And that's what holds all of this together. So you will be hearing a lot more in the workshop on the 9th, I believe, on return on values, and they might be interested for you to now hear how this is now put into action. And basically, when we talk about this, we are talking now about ROI, the ROV, that will now be a forward-looking measure of success that gives equal weight to environmental stewardship, social cohesion, long-term resilience, and socio-economic growth. And we're concentrating on that, on environment, economic, social, and political. So in short, ladies and gentlemen, the National Planetary Health Action Plan brings all of these 6 areas together into one integrated framework that is held together by the 5 systemic shifts and are unifying all that with written on values and grounded on the 4 foundational principles. And to our knowledge, this plan is the first among ASEAN countries and in the world. So how do you now operationalize it? How do you now monitor it? I guess that will be the next question that is all in your mind. So Malaysia, national commitment for healthy planet, healthy me. We do not want to use healthy you, because if you say healthy you, that means if you don't do it, why should I do it? You know, so we say no, healthy me. So basically, healthy planet, healthy me, prosperous Malaysia, and embed planetary health into our daily life and decision making, ensuring that every policy, investment, innovation supports a future where people and planet thrive together towards a sustainable and resilient future. And basically the plan calls for, number 1, you gotta have the governance in place in the country. And that is why we say strengthen governance through a mandated National Sustainability Council, not National SDG Council, not National ESG Council. We put them all together to create a National Sustainability Council chaired by the Prime Minister, so that we can align and enforce national commitments under SDG, ESG frameworks, and planetary health priorities. Secondly, to build intelligence system, including the National Environmental Genomic Database Framework to strengthen environmental and health monitoring. We have already started this, we have piloted this, and this will now be able to send that towards the whole country. The third one, to establish a robust impact tracking framework based on our strategies, our action plan. We have developed KPIs so that now we can hopefully use this impact tracking framework to monitor, to evaluate, and improve the effectiveness of the planetary health initiatives. And lastly, this is a whole nation approach, and we need behavioral change, all right, supported by a transformational sustainability leadership module to actually reshape leadership across public, private, and community sectors. So, again, you might ask the question, what sets the plan apart? Basically, I'm sure as in most countries, each country has their own sustainability policies, while Malaysia has introduced many sustainability policies over the years. But what makes the National Planetary Health different is that it does not stand apart from these policies, it connects and amplifies them. Typically, in the past, strategies were often implemented in silo. We are all guilty of that. All right, because one ministry will take care of biodiversity and it will now implement biodiversity by that ministry. Another ministry takes care of energy and that is the same again, working in silo. Another on health and another on food. But all of these are actually interlinked. And that's what we're trying to now say. The National Planetary Health Action Plan breaks down these silos, aligns actions, and makes sustainability a shared responsibility across the government, the business, the academia, and society. And it, of course, embeds STI at its core, ensuring the plan is not only comprehensive, but the plan must also be systemic and practical and, of course, future-ready. Earlier policies laid the groundwork, but the plan now connects the dot, mobilizes the STI, and hopefully builds the bridge towards a Malaysia that is more resilient, that is more fair and prosperous, but this time around, thriving within planetary boundaries. Well, the next question you might ask was that, well, this is a plan, but does it reach out to the individual? Because if this does not cascade, as what Tan Sri Jamila had mentioned, as what Sam Ayers had mentioned, if we don't own it, if the whole Malaysian don't own it, it doesn't really work. So basically, the success of this plan will now be depending on effective implementation and on Malaysians truly feeling a sense of ownership over planetary health. But as we all know in the room, planetary health can be a little bit abstract to the layman. All right, and basically it can live, when it is abstract, leaving people, because you can't hold the planet in your hand, you know what I'm trying to say? So it can be abstract, and when it does that, it gets people feeling a bit powerless, a bit disconnected, and also wondering, do my small actions really matter? So the solution, therefore, to us is to mainstream planetary health in education from preschool to universities. And I'm glad to announce that this is already part and parcel of the education blueprint, which is starting in 2027, next year, as well as the higher education blueprint to the universities in 2026 as well. So this is now going to be seamless. We're going to move from linear thinking to systemic thinking, starting from next year, from preschool all the way to the universities, because to us, education is key. All right, if we can now turn around this, there's a lot of things that we can now move together. And effective communication. I think the group before was already discussing about effective communication that can make planetary health real as well as relatable. Everyday choices that people make, like reducing food waste, conserving energy and water, planting green plants and living that in your office, supporting planet-friendly business, and using public transport may seem small in isolation. But ladies and gentlemen, if you multiply that by 32 million Malaysians, they can shift markets, cut pollution, lower costs, and drive a lasting change. So with that, on behalf of the 70 research experts and analysts that helped make this plan into reality, with ideas and suggestions from more than 3,500 scientists, policymakers, civil society, youth, and business, we thank all of you for being here, and we know that we cannot do this alone, so we are in the right room with the right kind of people that breathe the same air and have the same rhythm. So let us now collaborate and make a difference to a healthier planet. With that, thank you very much. You can download using this QR code. You can download, and this is the book. Well, basically, this is executive summary about how we do the plan, and you can read a little bit more about this. We will also leave cards that have the QR code so that you can download the document at the registration. Starting, you can get it from us now, or you can wait until tomorrow, whatever. So you can then download, and we hope to be able to now collaborate with all of you. Thank you so much.
Professor Asmil, I want to give you this plaque in recognition of the extraordinary work of the government of Malaysia. Thank you.
There are a lot of people who are involved in this together. Can we all stand up, please? You share this with me. It's not alone. I cannot do this alone. All of you, please, Mahendran, all the team, please, stand up.
Okay, and now I get to introduce our very own Chantal Riggs, who is our community building and engagement coordinator for the final event of the day. Not the final event of the day. Well, second to final event of the day. Okay.
Hello, everyone. Good afternoon. Thank you again for joining us here this week. I'll be as fast as I can. I know we're a few minutes behind. I don't even have slides, so I'll make it quick. But I do want to clarify, this is not the last session of the day. We have the Regional Member Assembly at 4:30, so please stay for that. My name is Chantal Riggs. I'm the Community Building and Engagement Coordinator at the Planetary Health Alliance. And in my role, I have the honor of coordinating both our global members community, but also running our Next Generation Network and the programs within that. Before we move into our last session of the day, I want to take a moment to recognize a few individuals within our global planetary health community with the inaugural Planetary Health Youth Prize. Youth engagement is something we take very seriously at the Planetary Health Alliance. For us, next generation doesn't just mean children. It means students, early career professionals, and anyone within the age group of 13 to 35 years old. Our next generation initiatives are some of our longest operating programs, and we're continuing to develop opportunities to reach next generation individuals globally, including supporting 18 youth travel scholars to attend this year's Planetary Health Annual Meeting. The inaugural Planetary Health Youth Prize is being awarded today to represent the importance of youth and next-gen voices in the planetary health movement, and to set a precedent for our commitment to prioritizing their involvement in our work. Earlier this year, the Planetary Health Alliance's Next Generation Youth Council, who's only in their second year, held the first Planetary Health Global Challenge, which was a global competition designed to inspire innovative solutions addressing the impacts of destabilized natural systems on human health and all life on Earth. By fostering transdisciplinary and international collaboration, the challenge aimed to generate holistic, equitable ideas that protect and regenerate Earth's natural systems, ensuring a thriving future for all. We challenged participants to submit written project proposals addressing the intersection of planetary health and freshwater access. Ensuring equitable and sustainable access to fresh water is essential for maintaining a stable and resilient planet and ensuring conditions in which all people can be healthy. Today, I'm excited to award the inaugural Planetary Health Youth Prize to the winning team of the 2025 Planetary Health Challenge: Ezekiel P. Gwanbi of Liberia, Dua Suleiman of the United Arab Emirates and Sudan, and Amira Puji Hastuti of Indonesia. Their winning proposal, Mazina moringa seeds and zeolite-based mercury filtration through indigenous empowerment, leverages indigenous knowledge in an innovative manner to reduce water pollution. Specifically, it addresses severe mercury contamination in the Kapuas River in central Kalimantan, Indonesia, where Dayak indigenous communities face significant health risks due to artisanal and small-scale gold mining operations. Ezekiel is a pharmacy student at the University of Liberia. His focus is on the intersection of climate change, infectious diseases, and community health action. Ezekiel brings skills in leadership, science communication, and research to address environmental challenges. And please join me in congratulating Ezekiel, who is joining us virtually today. Unfortunately, Dua was unable to join us today, but she is a researcher at Mohammed bin Rashid School of Government with a background in public health policy, environmental health, and pharmaceutical waste management. Her work focuses on antibiotic contamination in freshwater systems and its contribution to antimicrobial resistance. She brings expertise in health policy research, project management, and problem solving to address water pollution issues. She's also a speaker in some other sessions later this week, so I hope you can hear from her then. Amira studies nutrition and public health at the University of Indonesia. She discovered planetary health through her faculty and deepened her understanding during a Model United Nations conference. Amira, congratulations. And Amira, I'd like to present you the certificate for the Planetary Health Youth Prize on behalf of your team. Congratulations. Lastly, I'd just like to make a note that Ezekiel, Dua, and Amira will be presenting their winning proposal at the Next Generation session, which is tomorrow at 11 a.m. So please, I encourage you all to attend if you're interested in hearing more about their solution. Thank you so much.
Thank you. We're running a bit out of time, but the coffee break is already ready outside. this was not the last session of the day. We still have the session of the PHA Regional Member Assembly, so be back at 4:30 here. But before going to the coffee break, we have Orlak for a very short meditation. I think we all need it after this very full day.
Thank you very much. Good afternoon, everybody. I hope you're feeling as energized and as inspired as I am after such an afternoon of learning and connection and innovation. But right now, after such a busy day, I invite you all to sit with me and just to kind of reset and ground just for a few moments. So we can start by closing the eyes and just sit with your hands open on your lap. Just take a moment to turn the volume down on all your busy thoughts and worries, and just listen to the sound of the breath as it ebbs and flows into the body, filling every corner of our being. Just observing that sound, that music of life coursing through our bodies as we breathe in and out. If a thought crosses your mind, just let it pass and return to the breath. And in this stillness, what emotions arise for you? What can you feel? Label them. Just without judgment. Just put a name on those emotions that surge in you at this time. And still just listening to that sound of the breath. And in your open hands, visualize a large, thick, golden rope. Feel the weight of that rope in your hands. That rope runs through the hands of every person in this room, from the person next to you, to the person on your left, all the way running through every row and every seat, as we just sit in our connection with each other. This rope, symbolic rope, unites us in purpose, in love for this earth and the people on it. Allow yourself to sit for a moment and let that feeling of purpose and unity and love in every shape and form fill your being. Each breath inviting in that sense, and each breath out cleansing of every stress and tension you might carry. So with the breath in, we feel that love and unity and purpose, and the breath out, cleansing us. Invite a sense of relaxation into the body. That breath continuing in its rhythm, like the waves on the shore. And just simply allowing ourselves to be in this moment. We allow ourselves to feel a little bit of gratitude to ourselves for for taking some time to look after the mind and to each other, for our shared purpose, for our connection with each other. On the next breath in, take a deep, deep breath and squeeze all the muscles in your hands, or your legs, your feet. Hold it and exhale, releasing that tension, letting it flow into the ground and away. And one last one. Take a breath in, as deep as you can muster, squeezing all the muscles in your body. And exhale to release. And just let the breath return to its normal rhythm, slowly. And when you feel ready, you can slowly open the eyes, return to the room, return to the present, feeling refreshed and renewed. And we can just gently stretch, and in your own time, we can adjourn for a little bit of coffee before the last session. Thank you very much.
Thank you.